Hi, I wanted to welcome Amol Soin, the president of ASIPP, back to the podcast. Amol was on the podcast at probably the beginning of the pandemic, about a year ago. Is that right?
Yeah, it's been about a year already.
And a lot's changed since then. So what have you been up to?
I just became president of ASIPP, and it's been tremendously exciting. We have a lot of new things going on, and with the pressure of COVID starting to ease a little bit, it's provided us some opportunities to have some live meetings, some exciting new offerings from a society standpoint. And then, outside of ASIPP, just general life with kids and practice, things are starting to open up a bit more.
Are your kids in school full time yet?
Yeah, so they're in school, and that's been quite an adjustment for them, right? Being online and stuff for a while. Yeah.
So, mine are going back full time this week. Actually, that's why I was asking. But anyway, back to the pain. So this is ASIPP's first in-person event this coming June in New Orleans, correct?
Yeah, I mean, it's our first live meeting for what feels like an eternity. We didn't have an annual meeting last year that was live. It was virtual. So just excited to get back into it.
Are there any new topics that or new areas of focus since the pandemic? I mean, has the pandemic changed things so much that there'll be more focuses on anything in particular related to it, or anything else new in the world of pain?
Yeah, for sure. All the above, actually. So regarding the pandemic, well, we're going to have a couple of talks on the financial reckoning of COVID-19, how that will impact all of us as practitioners and owners of practices, or even if you work for a group or institution or large setting, COVID has definitely had some impacts on practice, and even little things, right? Like employee management at this point with various rules on quarantining, various types of assistance for unemployment, et cetera. It seems to be difficult to sometimes retain and recruit talented staff to work with you. Just a bunch of little things with COVID. And outside of COVID, for the first time, ASIPP is holding what we're calling an innovation summit. It's almost like a meeting within a meeting. In other words, as the meeting goes on, there'll be parallel sessions throughout the weekend, talking about innovation, bringing up all the latest and greatest pain management techniques, new types of devices, new types of neuromodulation stuff, radio frequency ablation techniques, interventional techniques. And, there's been a big explosion in pain management in minimally invasive surgical techniques for the interventional.
Absolutely. Yeah. I mean, I think even the referring docs are starting to become more comfortable with the idea of sending them to a pain physician for a spine intervention, aside from an injection, as opposed to the surgeon. So I think that's right on. Is this a separate meeting, or is this going to be part of the?
So it's actually part of the meeting, and once you're enrolled in the ASIPP Annual meeting, you can certainly attend the Innovation Summit sessions. I just thought this would be a really nice way for us at ASIPP to engage and provide quality to our members, particularly regarding new interventional techniques, new technologies. And at the same time, it's actually helpful for some of our industry partners to have a forum and opportunity to discuss some of their latest research. And so it's a partnership between our members, ourselves, and some industry folks.
Well, it's definitely the future. I mean, I see how PNS and minimally invasive spine is starting to reshape my practice and offer patients things that sometimes I would either have to send away, or maybe tell them that there's not much more I can do for their spinal stenosis or for their neuropathic pain. But I think it's great that you guys are thinking ahead and looking at this stuff. Let me ask you a question. You guys have always been very active politically. With the whole pandemic and our politicians not really working on the same, I guess, time frame as they used to be, has it been slowing down what goes on politically with pain management, or business as usual? I know that No Surprise Care Act, that the No Surprise Bill Act that came out earlier this year, and I did a podcast about that. But is there anything else brewing? Because I know before the pandemic, or even a year ago, we were talking about the facet joints and some of the other policies coming down.
Oh, quite a bit. You know, ASIPP, that's sort of the wheelhouse of ASIPP, right? Is to
Right.
make sure that physicians have access to these types of things and that the playing field is favorable for doctors to do these procedures. But you mentioned the facets. Currently, right now, Medicare is going over a local coverage designation for epidural steroid injections and percutaneous adhesiolysis. And that's a bread and butter procedure right there, epidural injections, cervical, thoracic, and lumbar. That's going to be a pretty massive undertaking for us. We're still working with all of the facet joint injection stuff. That national coverage designation, you know, has dropped recently, and we're all sort of looking and trying to adapt to those changes. At the ASIPP annual meeting, though, this is really interesting. We actually have the Medicare medical director who championed the entire facet joint and the epidural injection national coverage designation discussions nationally for Medicare. Dr. Meredith Lovelace will actually be there as a speaker. There's actually a second Medicare medical director, Dr. Earl Berman, that will be there as well. And this is the first time at an ASIPP meeting where we've had this level of engagement with Medicare. And it's just a great opportunity for us as physicians, for us as a society, to ask questions and to provide feedback directly to the source at Medicare. So this would be a tremendously exciting part of the meeting.
Amazing. I think a lot of people don't really realize what you guys do. Networking with you and Lax, I'm on that email list that you send out to some of the society's leadership, and the work that they're doing behind the scenes to kind of make a favorable climate for us pain physicians is a tremendous amount of work. And these are the docs like you who are practicing. It's not like this is your full-time job. So I think people really need to understand and appreciate and support what you guys do. And I personally didn't know much about it until I became involved and saw all of what you did. And I think it's fantastic.
Yeah, thank you. You know, and it's a really enjoyable part to be engaged at that level. I certainly love everything about pain management, pain medicine, from seeing patients, but also engaging on the political side. I mean, some people have hobbies that maybe they like to play golf or whatever, but I really enjoy doing things related to pain management. So it's tremendously fun for me and rewarding personally. Other things that ASIPP is doing, though, besides the set joint and epidural interventions, is ASIPP was real active on Capitol Hill this last year and a half, particularly regarding COVID and support of practices. So the CARES Act, the stimulus money that practices got, that was a percentage of their Medicare reimbursement from the year before. Initially, when that law was passed, it was actually designed only for hospitals. And ASIPP, in conjunction with other societies, lobbied hard to make sure, no, that shouldn't just go to only hospitals. It should actually filter down to all practitioners who see Medicare patients. And that was a nice thing for us. And also with telehealth and telemedicine, trying to lobby for more open access, to be able to use certain codes, to be able to do telephone-only visits in certain situations. Those are things that were important for ASIPP, and they were really working hard on during the pandemic.
So is telehealth here to stay in terms of reimbursement, I'm talking?
Yeah, I think it is. The reimbursement one's a very interesting issue because it seems like some states are doing their own initiatives on telemedicine. So for example, I'm from Ohio, and I'm actually on the Ohio Medical Board, and I get to see what's happening in our Ohio legislature about telemedicine, and they have their own bill and legislative effort to memorialize telehealth long-term. Regarding the reimbursement model, that's going to be interesting because it might vary regionally from state to state, depending on what your local state chooses to do and how they manage that. Now, certainly Medicare is the 800-pound gorilla. So as they make their decisions on how they want to manage telehealth, that might filter down to some of the larger insurance carriers. But regional advocacy is so important. And that's another, point about ASIPP is that we have 50 state societies, 51 if you count Puerto Rico. So, each state has an ASIPP chapter that hopefully will advocate for everyone across the country regarding these initiatives.
Right. With respect to the future in terms of upcoming policy changes or whatnot, do you see any red flags or anything that we need to be concerned about or pay special attention to?
I do, because look, this whole universe that we're living in right now is changing. And what's the big change, right? What's the future? Well, 10 years ago, we were talking about things with neuromodulation, spinal cord stimulation, perhaps owning your own surgery center. 10 years before that, it was like, oh, should you have your own C-arm in your office, et cetera. As I look to 10 years in the future, I think what we're going to hear a lot about are two things. One is regenerative medicine, the potential opportunities for that, pitfalls, et cetera. You're hearing about it now. I think that's only going to continue to grow. And the second, you're going to hear a lot about is artificial intelligence, machine learning, precision medicine, augmented decision-making for the physician. But my concern is that will percolate down to the actual payer. And they may use a artificial intelligent bot to data mine your medical record or billing codes to approve or deny procedures. And that can get challenging, right?
Yeah, especially in management.
Yeah. Every patient is different. There's different scenarios and variables that might make it hard. And I'm just concerned that if we don't talk about this, as say I'm doing right now or in other forums, and alert people about it, it's going to be hard to undo some of those things. So I think it's important for all of us at ASIPP and everyone to be vigilant up front. So you're going to start to see the first iterations of this with Medicare, for example. So, for the first time, starting in July, Medicare is going to require prior authorizations for spinal cord stimulators done inside a hospital. And they're doing it for other procedures too, like surgical fusions, and actually a lot of specialties. They're not only picking on pain. But as of right now, if I understand it correctly, their long-term vision and goal would be to have some sort of PA process that would be streamlined, to protect the Medicare trust fund. But when I hear those terms, I get nervous about, rationing and lack of access to care and some sort of AI bot kind of looking at stuff when we submit it and saying, okay, you can do this procedure, or no, you can't. That gets hard.
It's very scary. You touched on regenerative medicine, which I think, I think we all agree, or at least the evidence even points to it, that it works. So if it works, why don't they pay for it? And when patients ask me that, my answer is, well, there's a lot of good things they don't pay for. All things that you could do safely and cost effectively. But regenerative medicine could be a little more costly with respect to the time involved, the kits, sometimes depending on what you're doing, of course. So yeah, I'm curious to see how this one plays out because of, I think PRP is here to stay. I don't think that's going anywhere. So,
I completely agree with you. And it's just another point about ASIPP as a society, supporting it nationally, but potentially going to the annual meeting and being a part of it. Because right now, today, we're actually working with Medicare on a national coverage designation for some portions of regenerative medicine, including PRP, but also some amniotic fluid stuff. And that's actually being debated right now in small committees. And so, ASIPP had several subject matter experts with Medicare to discuss these items. And that's an important first step to actually get on the list to get these things reimbursed. One thing that we are concerned about is what you just mentioned, right? The kits are expensive, the cost of goods are expensive, and some of these may be cost prohibitive. So as we have these discussions with Medicare, that is so important to get out there, because the last thing you want is to have some sort of billing code or reimbursement model that actually pays less than the cost of goods to do the procedure. Because stuff like that's happened before with prolotherapy and stuff, for example, right? And it killed the therapy. And so we got to be careful with regenerative medicine, because you're right. The body's natural ability to heal, and coupled with some augmented healing properties of tissues that we know work, is probably vastly superior to doing like a total knee replacement or a major fusion surgery.
That's right. And I do think it's cost effective. The PRP, based on the fact that the studies show that patients are having longer lasting improvement than compared to steroids. And personal anecdotal experience, I see it in my practice. Patients who have PRP, a lot of them will come back asking for a different part of the body to be injected as opposed to a re-injection of that same part because they like the way they feel. And this is over 6 months, sometimes more, you know.
Technology is amazing, and so is progress, and that allows for more efficient cost savings. And you know, to that point, I was just thinking of something when you were talking. You know, we come from about the same generation of medical training, but you remember when you were in medical school, or you're in anesthesia rotation, and you saw people with coronary artery disease get bypass surgery, right? I mean, that looked awfully expensive. In the OR, their chest gets cut open, they put on a heart and lung machine.
Right.
ICU stay, all that stuff, not to mention just incredibly invasive for the patient. And now for a lot of that stuff, then going through your wrist with a little catheter, right? And, you know, angioplasty, stent, et cetera. Patient goes home the same day, infinitely cheaper, more beneficial for the patient. That's scientific progress right there. And I just wonder if we're going to look 10 to 15 years from now at these large multi-level open fusion surgeries and think, oh my gosh, can you believe we did that? All that trauma to the patient. We could have just done some regenerative medicine work. I feel like spine and pain is at that same tipping point that cardiac stuff was maybe 15, 20 years ago.
That's right. I went from leaving regenerative medicine as a last resort option to that discussion happens pretty much on the first visit because I feel like I'm doing my duty I'm not pushing them into it. I'm just explaining to them that this is an option. And this is probably an option I would take for myself.
Yeah.
So.
Yeah, I agree as well. It's just a tremendously exciting time to be a pain doctor. And now as we come out of COVID, you know, there's just going to be a lot of new and exciting things. And that's the point of this, you know, annual meeting is to try to get that sense of normalcy back, right? And we all can get together and talk about stuff like this. I'm having a great time talking to you right now. And just imagine being able to do that stuff live with everyone. I think it's going to be tremendous, you know.
I miss all that. And I'm very excited for the upcoming conferences. And so before I wrap it up, is there anything after this conference that's coming up from ASIPP that you want to announce to the group listening or anything like that?
Yeah, so we've learned a lot in COVID, particularly this whole Zoom interface in terms of opportunities for education and further engagement. And one thing that ASIPP does really well is, you know, educational conferences and certifications on different things, you know, like coding, compliance, board review, et cetera, all that stuff. And I know you do that incredibly well too. And we've really enjoyed working with you on those items. But coming in July, after the annual meeting, we're going to start doing some of those Zoom conferences again about coding compliance, you know, board review, et cetera. And those will be available, you know, to stream on the weekends live, or you could actually purchase them to stream on your own. We're actually going to have finally, hopefully, a live cadaver session targeting towards the end of July. I believe right now it's scheduled for the last week of July. And then as we move into the last half of the year, that's where a lot of state societies are going to be having their regional meetings. So, you know, there'll be a lot of stuff going on. And, you know, if you're a physician listening to this and you want to get involved in leadership or get involved in some of this stuff, there's a lot of opportunities at ASIPP, particularly at your local state chapter. There's always opportunities there, but also nationally. So, you know, really looking forward to getting more people engaged in the process. The more we have, you know, the stronger our voices can be collectively.
I agree. I think you nailed it. I mean, we need to support our societies and protect each other. So once again, the conference is in New Orleans.
That's correct.
June 25th or 6th.
Yeah, so it's right around that time, you know, June 22nd to about 25th, 26th, you know, it starts on the Thursday and it ends on Saturday, you know, in the early afternoon, New Orleans, which would be a great time. And the agenda is excellent, right? So not only do we have all the political stuff, we have, you know, a senator coming there to speak. We have all the Medicare folks coming there to speak. We have all the innovation stuff. We have educational stuff about new technologies. We have stuff about billing, how to manage a practice, kind of something for everyone. If you're interested in coming, there's just a lot of little pearls there. And of course, all the basic science stuff, abstract poster session for some of the new technologies. And that abstract and poster opportunity is still open for people that are looking to submit stuff.
Great. Well, Amol, thank you. It's always a pleasure. It's always great talking. And I know we both have busy days ahead, so I'll let you get back to business. thank you for coming on the podcast. And I really am happy that we're both standing here a year later and still working and thank God healthy.
Yes, thank you. Thank you for having me. Mm-hmm.